Gauteng Health MEC Nomantu Nkomo-Ralehoko says sexually transmitted infections have spiked in the province because of a shortage of condoms. Nkomo-Ralehoko says condom suppliers have not had stock since the contract began in February last year. All districts are affected by shortages. To discuss this, I'm joined by Mutalatale Mudiba from the Gauteng Health Department. Welcome to today, Mutalatale. Why is there a shortage?
Look, the shortage is caused by the fact that the supply of condoms is done through obviously a transversal contract, and there's issues of compliance with the South African Bureau of Standards that many of the suppliers obviously need to comply with. So, Gauteng being a large province, we make orders in large quantities, and our suppliers have indicated that they obviously are awaiting approvals from SABS in terms of their samples before they are able to make large orders. So that obviously has a trickle effect in terms of affecting us. I mean, if you look at, for example, in Gauteng, we receive over 4 million male condoms monthly, and just over 134,000 or so of female condoms. And if you look at the period between January and March 2023, you would notice that the amount of stock that we received was far below what we would have received monthly, and that was received within a period of 3 months. So the indication from the suppliers was that they've had that particular challenge, but we have ordered a stock in large quantities already, just to ensure that we're able to augment. We do have condoms in our facilities. It's just that we're not getting them in terms of the amount of supplies that we should be getting for us to sit comfortably to say we have more than enough stock in our facilities. So it's not that at the moment there are no condoms at all. We do have condoms. The only challenge is that at the moment the supply that we currently have it's low.
Let's talk numbers, Mutalatale. I mean, why such a huge discrepancy between male condoms and female condoms?
That talks to it's an issue of demand and supply in terms of usage. Male condoms remain popular in terms of usage. So there would be, if we look at historically over the years, well, there's always been a higher demand of male condoms than your female condoms. Even though female condoms are also marketed, but you have to look at what the market demands, and you can't you provide according to what the market demands. And at this stage, there's a higher demand for your male condoms as compared to your female condoms. So we've always had that disparity, that the male condoms will always be in larger quantities than your female condoms.
Now, obviously, reports suggest, Mutalatale, that STIs are spiking as a result of this shortage of condoms. What sort of messaging or awareness are you creating for the public?
Look, the safety messages around HIV and AIDS and the kind of message that we would normally promote when it comes to sexual health remains. Ultimately, we encourage members of the public to always be cautious, to always practice, the safe practices in terms of whenever they're going to engage in sexual intercourse. And insofar as condoms are concerned, they remain part of your key tools that we use insofar as stemming down HIV and AIDS and sexually transmitted infections. The fact that there is currently a bit of low supply does not mean that when people go to facilities they might not get them in large quantities the way they're used to. But and also we're still urging people to, I think, take precautions in terms of ensuring that we are not reckless, but also that you always protect yourself and your partner when it comes to engaging in sex, and we discourage engaging in obviously unsafe sexual practices that might end up putting people at risk. So the current challenge that we're currently experiencing should not be the reason why people would then suddenly not observe the safe practice that we've always promoted.
Now, as my parting shot to you, Matalatale, let's talk forward thinking. What are you doing or will you be doing to prevent a shortage of this nature in the future?
I think I need to make it clear that the shortage is not something that is within our control as Gauteng Health. It's an issue that affects that is national in nature. I think other provinces are also affected by the same, because remember that we are all ordering stock from pre-approved suppliers that are already approved at the national level. What we have done as Gauteng, we have already placed our orders long ago. It's just that the demand that we have, the suppliers at the moment, because of the approval issues, is battling a little bit. But we've engaged with National as well for them to also augment some of the stock that we have, so that we're able to at least bring the stock levels to a level where we can say we've got at least more than sufficient supply at this point in time.
That's Gauteng Health Department spokesperson Matalatale Mudiba. Thank you so much for joining us here on Today. Here